We're in New York. I'm in New York City right now, which is the epicenter of what's going on in the country. It is the most coronavirus cases. Let me give you a little update on just how many cases there are right now in the United States, in New York, and around the world.
Good morning, and thanks for joining us this Sunday. It's been another shocking and sobering week. Since we came on the air last Sunday, the number of cases in the U.S. has skyrocketed, climbing from roughly 25,000 cases to nearly 125,000 cases this morning. And worldwide, close to 700,000 confirmed cases. In the U.S., the virus has now claimed more than 2,100 lives, including the tragic death of an infant in Illinois announced yesterday. While New York has emerged as the epicenter in the U.S., cities like Detroit, Boston, New Orleans, and Chicago are experiencing a dramatic rise in cases and bracing for impact.
So, as you can see, we're already over 100. We're already over 2,000 deaths here in America, and unfortunately, I think it's going to get worse. I don't think at all it's possible that that's the actual number. Honestly, I mean, I would expect it to be a lot higher because a lot of people have not been tested, and a lot of people are not even able to get into the hospital right now. Hospitals are being overrun. To show you what our capitalist system, let's see what our capitalist system is doing for the folks right now. You ready for this? Looking to raise $60 for our room. My disability hits my account tomorrow. I've been ordered to stay home today by a doctor, and if my fever gets worse, to go to the ER. PayPal. As soon as I pay this, I could sleep. Laid off from my job because of COVID-19. If anyone is interested in online voice lessons, hit me up. Or if anyone is able to help, my Venmo is Brittany Kelly. Our landlord is still making us pay rent, and I'm stressing. What a dick. I agree. My husband has been in the hospital since February 3rd with pneumonia, but he has all the symptoms of virus, but not tested. Now with everything going on, I'm trying to find a job because he was our sole income and we have 4 kids. Please help Venmo Tanya. This pains me to do this, but here goes. I'm an unemployed artist and fighting a hopefully mild case of COVID-19. Ways to help out. And her art site. My town is among some of the hardest hit areas in Queens. I already lost my job, and I feel like my dad will be next to lose his. If that happens, we'll have no income for who knows how long. I've been trying to get help from Cash App and other celeb donators for a long time now, but I've had no luck. Please retweet this or help out. My dad is also at risk for catching the virus by going out every day, and if that happens, I don't know what will happen to him. My mom is sick. We've made many visits to the emergency room. She's a hairstylist and won't be able to work for God knows how long. That and the hospital bills. She's already had to take out loans to pay for rent. I'm in college, also out of a job at the moment. Anything helps. And there's a picture of her mom who's having to take out loans while dealing with coronavirus. I currently can't pay for my medications this month. I have spinal surgery coming up for my spinal injury, and I'm honestly so scared of how unwell I will be without my medicine. I'll link my story below. I'm deathly sick with a fever of 100.8, and I could barely breathe. My rent is due, and I have no money, and I will lose my apartment if my rent isn't paid. Please, anything will help. I live with an 8-month-old and a mom on disability, and her Cash App. How's that? How's that for greatest country in the world? How's that for shining city on a hill? By the way, Jen sent me, I think, 10 to 20 more, but I didn't have time to load it all. If Jen and I, or you, want to go through, just hashtag my Venmo or GoFundMe, it is literally exposing the capitalist. You want to call it a system? The capitalist scam. those people that I just showed you, this fairy tale bailout, it's not going to help those people right now. For the people getting laid off, the money's not coming to them right away. For the people with, Joe Biden during the debate said, oh, coronavirus, you won't have to pay. Oh, yeah? Because those people are already getting hospital bills. The bill, the corporate bailout that Congress just passed has nothing. There's no provisions in there for free testing or free coverage. And what about the people, including ones I've already interviewed, that have gone to the emergency room, were told, well, we don't have any tests. Sorry, go home if you're not feeling well. Quarantine yourself. They're getting hit with a bill. People are having to do GoFundMes for masks. People are having to do GoFundMes to meet their rent. Mothers with coronavirus are laying in a hospital simultaneously having to take out loans to stay afloat. To me, I mean, people say on Twitter, now's not the time for politics, Jordan. No, now is the time for politics, because political decisions and political corruption is why you are seeing average people basically being victims of the economic Hunger Games that is capitalism. Political decisions, not just by President Trump, but by the Democratic Party that has enabled this Republican treachery, by the Democratic Party that is bought off by Wall Street, that is bought off by the lobbyists, that is bought off by all the special interests, have created a system with no safety net. There is no safety net. You think Donald Trump is really going to pass legislation that makes coronavirus treatment, which, by the way, estimates are saying it could be up to $35,000 if you've gone to the hospital? You think Donald Trump is going to make that happen? You think Joe Biden is going to make that happen? You're mistaken. If you don't believe me, coronavirus may add billions to the nation's healthcare bill. Insurance premiums could spike as much as 40%. 40% next year. With so much still uncertain about how widespread hospitalizations for coronavirus patients will be around the U.S., a new analysis says premiums could increase as much as 40% next year if the pandemic results in millions of Americans needing hospital stays. Quote, health plans went into 2020 with no hint of coronavirus on the horizon, said Peter V. Lee, the executive director of Covered California, the state insurance marketplace created under the Affordable Care Act, which conducted the analysis. To protect businesses and individuals from sharply higher rates, he supports a temporary federal program that would cover some of these costs. Oh, some of these costs. So if you get hit with a $20,000 to $30,000 bill for going to the hospital for coronavirus, God knows how much it costs to be on a ventilator. If you survive after that, we'll cover some of your costs. I don't know. How does that sound if you get hit by a $35,000 to $40,000 bill? We'll cover like $10,000 of that. No insurer, no state planned and put away for something of this significance. That's not to mention, you remember good old Pete Buttigieg? Mayor Pete saying, how dare you, Bernie Sanders, try and take away Americans' choice. Americans love their private health insurance industry. Americans love their health care providers. They want the choice to keep paying out of pocket thousands and thousands of dollars. Don't take away people's choice. Same thing with Joe Biden. Same thing with Elizabeth Warren when she moonwalked away from Medicare for All. Do not take away people's choice. Well, Bernie Sanders doesn't have to take away their choice because employers right now are taking away their choice. Because when you have health care connected to an employer. If your employer discontinues it because you go on strike, ask the General Motors folks about that a couple months ago, or there's an unforeseen disaster like a highly contagious virus that forces businesses to close down, or in 5 years from now, 7 years from now, 10 years from now, when the inferno comes our way, I don't call it the climate crisis anymore, I call it the inferno, well, businesses are going to have to lay you off then too, because you can't keep your business open if your business is on fire or underwater, right? So literally, and this is from Wendell Potter, who I interviewed this morning, and I'm going to play that interview for you, but I want to read this to you first. This is from Wendell Potter. He was for many, many years an executive at for-profit healthcare industries. Since then, he has been an outspoken critic of the for-profit healthcare industry and a champion of Medicare for All. He says, the tragic effects of our battle with the novel coronavirus are seemingly endless, but arguably the most mind-blowing is this. The very pandemic that threatens to infect and kill millions is simultaneously causing many to also lose their health coverage at their gravest time of need. Here's how. The virus has caused a public health crisis so severe that people have been forced to stay home, causing businesses to shutter and lay off workers, and with roughly half of Americans getting their health insurance from their employer. Again, half of Americans getting that health insurance from their employer that Amy Klobuchar and Pete Buttigieg, how dare you, you're going to rip healthcare away from their rip people's private healthcare away, you're going to leave them stranded, the neoliberals say. These layoffs mean not only losing their income, but also their medical coverage. In other words, just as our need for medical care skyrockets in the face of a global pandemic, fewer will have health insurance or be able to afford it. According to one recent report, the cost of treatment for COVID-19 can run around $35,000. As the patient in the report exclaimed, I was pretty sticker shocked. I personally don't know anyone who has that kind of money. So how do we get to such a dire place? Many will sadly lose their jobs over the coming weeks, with one estimate projecting as many as 30%. And as they do, Americans are about to learn something horrifying: how irrational and irresponsible it is for so many to be dependent on employers for health insurance. Take it from me. I'm a former health insurance executive who once profited from this system. It's time for it to stop. Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.